Okay, so yes, it is primitive. It is primitive atrium. It is primitive atrium. And what you see here is the primitive primitive ventricle. What you see here is the primitive ventricle, and what you see here is the bulbous cordis. Is the bulbous cordis. Okay, is the bulbous cordis, and what you see here in the uh, in the blue color is the sinus venosus. If you see the sinus venosus has got two horns. Let us consider this is the right horn of the sinus venosus, and this is called as the left horn of the sinus venosus. Left horn of the sinus venosus. And when you see the each horn has got three tributaries in them. Each horns has got three tributaries in them. Okay, so you got three tributaries in them. When you see the tributaries, okay, when you see the tributaries, this tributary is called as the umbilical vein. This is the umbilical vein. Okay, and this is the vitelline vein. Vitelline vein, and this is the common cardinal vein. This is the common cardinal vein. This is the common cardinal vein. Common cardinal vein is also called as the duct of Cuvier. Is also called as the duct of Cuvier. It is also called as the duct of Cuvier. It is also called as the duct of Cuvier. Common cardinal vein is also called as the duct of Cuvier. You got the common cardinal vein, vitelline vein, and umbilical vein on both the horns, both on the left horn and on the right horn. But as the heart develops and as the heart grows, the left horn slowly regresses. The left horn slowly regresses. Okay, so the left horn regresses and finally forms a part of coronary sinus. And finally forms a part of coronary sinus. Okay, remember guys. So left horn regresses and forms a coronary sinus. Okay, whereas the umbilical veins disappear and the vitelline vein becomes a part of IVC, becomes a part of SVC and IVC, which opens into the which opens into the sinus venosus, and when you look into the primitive atrium and primitive ventricle, they develop into the atrium proper and the ventricle proper. And when it comes to the bulbous cordis, okay, and when it comes to the bulbous cordis is divided into three parts. Okay, so the proximal one third, the middle one third, and distal one third, and the distal one third. Okay, what do they develop into? And the proximal part of the bulbous cordis develops into primitive ventricle. They develop into primitive ventricle, and the middle one third of the bulbous cordis, they form the outflow tract. They form the outflow tract. And the distal portion of the bulbous cordis, they form a part called as truncus arteriosus. And this truncus arteriosus becomes the aorta and the pulmonary artery. Aorta and the pulmonary artery. Okay, so when you talk about the bulbous cordis is divided into three parts. The proximal one third is absorbed into the primitive ventricle. The middle one third forms the outflow tract of the ventricle, and the distal one third forms the truncus arteriosus, which is divided into two by means of a septum called as spiral septum. Is by means of a septum called as spiral septum, which is called as spiral septum, and that spiral septum divides the truncus arteriosus in a specific way into an aorta and pulmonary artery. If you remember, guys, if the spiral septum is not formed properly, if spiral septum is not formed properly, okay, so spiral septum defects can lead to conditions like transposition of great arteries. Transposition of great arteries. Spiral septum defect can lead to transposition of great arteries, and it can lead to conditions like tetralogy of Fallot. Tetralogy of Fallot can also occur due to the defect in spiral septum. Is also can form in defect in the spiral septum. Okay, so all these are very important points. Spiral septum defect can occur due to can cause transposition of great arteries and can cause tetralogy of Fallot. Okay, So with this, we'll go to the next part. That is very very important topic. Again, frequent questions have come from this area. It is the joints of the thorax. So when you see the joints of the thorax, there are a lot of joints in the thorax because there are a lot of bones involved in the thorax. Okay, so if you see the thorax on the posterior part, you got the vertebrae. On the anterior part, you got the sternum, and they are connected by the ribs. They are connected by the ribs. They are connected by the ribs. Okay, so I'm just going to draw a simple schematic diagram. So this is the vertebra. Okay, this is the vertebra, and let us consider this is the sternum. So the rib is connected. The rib is connected from posteriorly vertebra to the anterior portion. Um, that is the sternum. Okay, so what are the part this rib articulates? If you see the rib articulates with the body of the rib articulates with the body of the vertebra, and this part is called as an costovertebral joint. This is called as an costovertebral joint. This is called as an costovertebral joint. The rib articulates with the transverse process, which is called as an costotransverse joint, which is called as an costotransverse joint, which is called as an costotransverse joint. Now, when the rib comes anteriorly, if you see the rib, when it comes anteriorly, okay, when it comes anteriorly, a part of the rib is cartilaginous in nature. A part of the rib is cartilaginous nature. So the bone and the cartilage joins in this portion to form the costochondral joint. Costochondral joint. And the rib articulates with the sternum to form the sternocostal joint. To form the sternocostal joint. To form the sternocostal joint. Okay, to form the sternocostal joint. So remember, the costovertebral joint and the costotransverse joint, they both are synovial joints. They both are synovial joints. They both are plain synovial joints. They both are plain synovial joints. Okay, say they both are plain synovial joints. They both are plain synovial joints. Very, very important question. Costochondral joint is an primary cartilaginous joint. It is a primary cartilaginous joint. It is a primary cartilaginous joint. I will tell you what is called as a primary cartilaginous joint. Primary cartilaginous joint means there will be two bones, and the two bones are connected by an hyaline cartilage. Very simple. Okay, so what is called as a primary cartilaginous joint? Primary cartilaginous joints are two bones which are connected by an hyaline cartilage. That is called as a primary cartilaginous joint, which is also called by another name called as synchondrosis. Which is also called by another name called as synchondrosis. Which is also called by another name called as synchondrosis. When you take the sternocostal joint, only the first sternocostal joint is synchondrosis in nature. That is primary cartilaginous joint. Whereas all the other sternocostal joints are synovial joints, are also called as synovial joints, whereas the other sternocostal joints are synovial joints. Okay, so apart from the costotransverse joint, costovertebral joint, costochondral joint, apart from this, you got other joints here. To name a few, the intervertebral disc. Okay, the intervertebral disc. You see between the vertebrae, you got the intervertebral disc, which is basically an secondary cartilaginous joint, Okay, and in the front, you got the manubriosternal joint, manubriosternal joint, which is also an example for secondary cartilaginous joint, whereas the ziphisternal joint, between the body of the sternum and the xiphoid process, the ziphisternal joint is a primary cartilaginous joint, So many joints are involved here again. The intervertebral disc between the vertebrae or secondary cartilaginous joint. The joint between the manubrium sternum and the body of the sternum is a secondary cartilaginous joint. And the one between the xiphisternum and the body of the sternum is a primary cartilaginous joint. All are potential MCQ area. Okay. And there is only one joint left here now. That is called as an interchondral joints. These interchondral joints are all examples for plain synovial joints. synovial joint. They're all example for plain synovial joint. The interchondral joints are all example for plain synovial joints. Are all examples for plain synovial joints. So important potential question area. So they can give you any of this joint and they can ask you what type of joint is this. So please do remember. Always remember the primary cartilaginous joint. Okay, at one point of time they will completely fuse and they form a bone. Okay, so at some point of time the joint disappears and it completely forms the bone. That is the nature of primary cartilaginous joint. That is why it is also called as synchondrosis. That is why it is also called as synchondrosis. So with this note, we'll go to the next vertebra. So they can give you a picture like this and they can ask you what vertebra is this. The simple way to identify the vertebra is when you look into the body of the vertebra, this body of the vertebra is heart shaped. This body of the vertebra is heart shaped. When you have an heart shaped vertebral body, then that is called as an thoracic vertebra. Then that is called as an thoracic vertebra. So this is an heart shaped body. Heart shaped body. If you take a lumbar vertebra, if you take a lumbar vertebra, okay, if you take a lumbar vertebra, the lumbar vertebra body will be like this. Okay, the lumbar vertebra body will be like this. It is like an bean shaped or a kidney shaped or reniform shaped. So it is like an kidney shaped. So lumbar vertebra is kidney shaped body, whereas the thoracic vertebra is like an heart shaped body. It's like an heart shaped body. When you go to the posterior aspect of the vertebra, you have got the pedicles here. You have got the pedicles here, and then you have got the superior transverse process and the transverse process here, and this is the transverse process. This is the transverse process. This is the lamina here. This is the lamina here, and this is called as an spinous process, and this is called as an spinous process. This is called as a spinous process. The transverse process in the thoracic vertebra are usually long. The spinous process are usually pointed downwards. They are usually pointed downwards. They are usually pointed downwards. Very, very important point. The spinous process of the thoracic vertebrae are pointed downwards. The transverse process are directed posterior and they are slightly long. They are slightly long. Okay. If you see the vertebra from the sides, if you see the vertebra from the sides, so let us consider this is the thoracic vertebra. Let us consider this is an thoracic vertebra, and this is an pedicle, and this is a transverse process which is seen here. And this is a transverse process which is seen here. What is classical seen on the lateral side of the body is you see a facet here and you see a facet here. These facets are called as demi facets. These facets are called as demi facets. So they are called as demi facet. Why it is called as demi facet? Because the facets are half in nature. It is called as demi facet. What articulates here? Rib articulates here. So they are called as costal demi facet. Costal demi facet. Okay. So what rib articulates with this? See, for example, if you take this is an T6 vertebra, if you take this is an T6 vertebra, the superior facet articulates with the sixth rib and the inferior facet articulates with the seventh rib. Very, very important point. Very, very important point. When you see the vertebra body from the sides, it has got a half facets in it. They are called as demi facets, and what articulates with it? The structure that articulates with that is the rib. That is why it is called as a costal demi facet. So the upper facet, the facet which is present in the upper part of the body, articulates with the corresponding rib. Very, very important. The lower facet articulates with the rib that is below. Rib that is below. So at T6 vertebra will articulate with the sixth rib above and with the seventh rib below. Very simple. See, many times these are very, very simple facts. When you study, you will get confused, or when it comes to the question, also, exam, also, you will get confused. Okay, so very simple. Okay, clear. Now, they may ask you how to differentiate an thoracic vertebra from the cervical vertebra, which is slightly above, So in a cervical vertebra, if you see the cervical vertebra, okay, if you see the cervical vertebra, so the cervical vertebra body will be small. The cervical vertebra body will be small, And the transverse process of the cervical vertebra will have a foramen called as foramen transversorium. Will have a foramen called as what? Foramen transversorium. So if you have foramen transversorium, if you have foramen transversarium, if you have foramen transversarium, then that is what? Cervical vertebra. Then that is what? Cervical vertebra. But foramen transversarium is absent in this thoracic vertebra. Is absent in this thoracic vertebra. All are very very important points. All are very very important points. Okay. So when you talk about the vertebrae, they can ask you to differentiate the vertebra. So there are certain points based on which you can differentiate the vertebra. Okay. And this spinous process can act as a landmark for various levels. See, for example, the inferior angle of the scapula, it corresponds to the T7 thoracic spine. Corresponds to the T7 thoracic spine. And the spine of scapula, the spine of scapula, the root of spine of scapula, the root of spine of scapula corresponds to the T3 spinous process level. Corresponds to the T3 spinous process level. Okay. And so in similar way, there are various landmarks. So you can go through it and you can make a list of it also. You can make a list of it also. I hope I am sounding clear. I hope you understood how the rib articulates. What is the costal demifacets are meant for. What is the costal demifacets are meant for. Okay. Costal demifacets are meant for. Okay. So with this, we'll move to the this will move to the next VSV. Okay, so the next VSV is again based on the intercostal spaces. Okay, based on the intercostal spaces. See, there are totally 12 ribs and there are totally 11 intercostal spaces, of which the third to sixth intercostal spaces are typical intercostal spaces, and they contain external intercostal muscle, internal intercostal muscle, and innermost internal intercostal muscle from outside to inside. Each of this contains two intercostal arteries, anterior intercostal arteries. Thus, two anterior intercostal arteries are derived from the internal mammary artery. They are derived from the internal mammary artery. They are derived from the internal mammary artery. Okay, they are derived from the internal mammary artery. And the posterior intercostal arteries are branches of the abdominal aorta, are branches of the thoracic aorta. Okay, are the branches of the thoracic aorta, are branches of the thoracic aorta, are the branches of the thoracic aorta. Okay, are the branches of the thoracic aorta. And each of the post intercostal artery gives a collateral branch which runs on the lower part of the space, which you can see in the diagram also, Okay. So there will be an intercostal nerve which is running in the intercostal space. The major structures, that is the intercostal arteries and the intercostal nerve, they run along the lower border of the upper rib. They run along the lower border of the upper rib. That is why when you aspirate the fluid, the needle should be near the upper border of the lower rib. Okay, so you should put the needle here rather than here. Okay, because the uh, upper border of the space contains all the vital structures. So when you put the needle towards the lower part of the space, you will not injure those vital structures. Okay. And remember, the intercostal nerve from the second intercostal space, it supplies the inner arm, which we have already seen, which is also called as intercostobrachial nerve. That is why it is also called as intercostobrachial nerve. Okay, so we have got the typical intercostal spaces here. I will tell you the typical ribs here, or the true ribs here. The true ribs are the 1 to 6 ribs are true ribs. 1 to 6 ribs are true ribs. Okay, and the false ribs are 7 to 10th ribs are false ribs, and the floating ribs are the 11th and 12th ribs, so true ribs, false ribs, and floating ribs. Okay, in a very similar way, typical thoracic vertebra, we saw thoracic vertebra just now. Typical thoracic vertebra are second thoracic vertebra to ninth thoracic vertebra. Okay, so T1, T10, T11, T12, these thoracic vertebrae are atypical vertebrae. Atypical vertebrae. Okay, very, very simple. But potential MCQ questions, the typical thoracic vertebrae are T2 to T9, whereas T1, T10, T11, and T12 vertebrae, they are atypical vertebrae. They are atypical vertebrae. Okay. So with this note, we'll move to the next VSV, where they have pointed a space on the posterior aspect of the heart, and they're asking you what is this sinus called as. So if you want to understand this sinus, you need to understand the lateral view of thought. If you see the lateral view of thought, this is the lateral view of thought. Okay, what you see here is the base of the heart. What you see here is the base of the heart, and you all know base of the heart is found with left atrium. Is found with the left atrium. Is found with the left atrium, and you also know that left atrium receives the pulmonary veins. So two pulmonary veins on one side, and there will be another pulmonary veins on the other side. Okay, and if you see the heart is covered by uh, covering called as pericardium, and this pericardium is lying close to the heart, which is called as in visceral pericardium. Okay, when it comes to the root of the heart, it slips posteriorly and forms the parietal pericardium. So what you see here is the parietal pericardium on outside. So what you see here is the parietal pericardium is called as an parietal pericardium and what you see here is called as an visceral pericardium. Now when you see this pericardium, there is a space which is present here, which is called as an oblique sinus, and this oblique sinus is bounded anteriorly by the left atrium. Yes, this is anteriorly by the left atrium. Now it is postly bounded by the parietal pericardium. Yes, it is by the parietal pericardium. On either side, you got the four pulmonary veins. Yes, you got the four pulmonary veins. Yes, and below it opens into the pericardial cavity. Very good. It is very, very simple now. So the heart is a structure which is covered by the pericardium. Okay, so it is like peritoneum. Okay, so the peritoneum or pericardium are balloon-like structures into which the viscera goes into it, and the pericardium or the peritoneum covers those viscera. So those layers which are lying close to the viscera becomes the visceral layer, and those lies away from the viscera becomes a parietal layer. So you get a sac here. It is very clear now. This is called as an oblique sinus. What is the importance of oblique sinus? So whenever there is an increased cardiac activity, so the increased venous return to the left atrium is accommodated by the expansion of the left atrium. So for the left atrium to expand, there must be a cul-de-sac behind which it can expand easily. So that is why for expansion of the pulmonary veins in the left atrium, so there is a sinus behind it which is called as an oblique sinus. There is another sinus called as transverse sinus which is present between the or which is present behind the root of the great vessel. So transverse sinus is another sinus. Transverse sinus is another sinus which is present behind the aorta, and the pulmonary trunk, which is present beyond the aorta and the pulmonary trunk, Okay, so this is the transverse sinus and oblique sinus spaces in the pericardial cavity, Okay, so with this note, we will move to the next question. So, which is again in a simple question which is asked in the previous NEET exams. These questions had come. They would have given a picture like this, and they'll ask you what does this marked structure represents. Okay, this is a structure which extends from the transverse process of C7. So this is nothing but the transverse process of C7. Transverse process of C7 to the first rib, okay, to the first rib. So it extends from the transverse process of C7 to the first rib. This membrane covers the cervical pleura. So this membrane covers the cervical pleura. So this cervical pleura is covered by this membrane. This membrane is called as a suprapleural membrane, also called as in Simpson's fascia. Also called as what? Simpson's fascia. Now what is this fascia basically? This fascia is a degenerated part of the scalenus medius muscle. You got three muscles in the neck: scalenus anterior, scalenus medius and scalenus posterior. A part of the scalenus medius degenerates and to form a membrane called a suprapleural membrane, also called a substance fascia. We have seen the attachments just now, and sometimes it contains a small muscle called as scalenus minimus muscle. It contains a small muscle called as scalenus minimus muscle. Okay, and what is its function? It protects the cervical pleura and the lung apex. It protects the cervical pleura and the lung apex. In other words, it closes the thoracic inlet. It acts as a diaphragm for the thoracic inlet. Okay, so it acts as an diaphragm for thoracic inlet. Okay, for thoracic. Okay, for thoracic inlet, yes, it acts as a diaphragm for thoracic inlet. Now, subclavian vessels and brachial plexus, they all run over it. So that is what is given in this diagram. So subclavian vessels and the brachial plexus runs over this membrane. Okay, so this is a very, very potential question. They can ask you, they will mark this and they can ask you what is this membrane, or they can ask you what is it degenerated part of it, or what muscle is present in it. Any of the question can come in the exams. Okay. So next is they can give you an picture like this and they can ask you what is this vessel represents. If you see this vessel closely, this vessel arises from the subclavian artery. Okay, so what you see here is the arch of the aorta. So this is the arch of the aorta. This is arch of aorta. Yes, no doubt in it. What you see here is the brachiocephalic trunk. What you see here is the brachiocephalic trunk, and this brachiocephalic trunk divides into the common carotid artery and the subclavian vein and the subclavian artery and the subclavian artery. So from the first part of the subclavian artery, you get this vessel which is called as an internal mammary artery, which is called as an internal mammary artery, which is called as an internal mammary artery. Okay. So remember, this internal mammary artery runs behind the ribs, and it gives two anterior intercostal arteries in each spaces. It gives two anterior intercostal arteries in each spaces. Okay, and finally it divides into musculophrenic artery and superior epigastric artery after crossing the sixth intercostal space. Okay. This artery also gives rise to perforating branches in the second, third, and fourth intercostal space, supplying the mammary gland, which is an very, very important supply for the mammary gland, which is a very, very important supply for the mammary gland. Also remember, the superior epigastric artery, the superior epigastric artery, okay, the superior epigastric artery runs behind the rectus sheath, runs behind the rectus sheath and anastomosis with the inferior epigastric artery and anastomosis with the inferior epigastric artery. Okay, this inferior epigastric artery is a branch of inferior epigastric artery is a branch of okay, inferior epigastric artery is a branch of, can anybody tell me inferior epigastric artery is a branch of? Yes guys, inferior epigastric artery is a branch of, superior epigastric artery is a branch of subclavian artery, we know that. Inferior epigastric artery is a branch of, yes, anybody? Inferior epigastric artery, very, very important question. Inferior epigastric artery is a branch of external iliac artery. Is a branch of external iliac artery. Very, very important point. Okay, so if you, very good Vignesh, very good. So if you see here, the superior epigastric artery is a branch of subclavian artery which supplies the upper limb, and inferior epigastric artery is a branch of external iliac artery which supplies the lower limb, Okay. So subclavian artery supplies the upper limb, external iliac artery supplies the lower limb. Now a vessel which is supplying the upper limb and a vessel which is supplying the lower limb are connected by an anastomotic network, that is through this epigastric artery. And very, very important anastomosis that takes place within the rectus sheath behind the rectus abdominis muscle. Okay, behind the rectus abdominis muscle. Okay, fine. So this is about the internal mammary artery. With this note, we'll go to the next part of the VSV session. So what they have given is they can put an arrow here. They can ask you what is this represents. So if you see this, they are talking about a space between the two lungs, which is called as mediastinum. So what is mediastinum? Basically, mediastinum is a space between two lungs. Space between two lungs is called as mediastinum, and this is divided into a superior mediastinum and inferior mediastinum by means of an imaginary line running through the T4 vertebra, and anteriorly this runs through the uh, manubriosternal joint. Okay, so if you see the superior mediastinum is bounded anteriorly by the manubrium sternum. It is bounded postally by T1 to T4 vertebra. Superiorly, it is the inlet of the thorax, and inferiorly, it is an imaginary line running from the sternal angle to the T4. So this is boundary. So what you see here is the manubrium. What you see here is the manubrium. What you see here is the T1 to T4 vertebra. And what you see here is the first rib. What you see here is the first rib. So they form the boundary for the superior mediastinum. Okay, below the superior mediastinum you have got the inferior mediastinum, and this inferior mediastinum is divided into three portions. One is called as an anterior, middle, and posterior mediastinum. Anterior, middle, and posterior mediastinum. Okay, remember, so the inferior mediastinum is divided into anterior mediastinum, middle mediastinum, and posterior mediastinum. Middle mediastinum and posterior mediastinum are very very important because middle mediastinum contains the heart, and the posterior mediastinum contains the important viscera, namely the esophagus, abdominal, thoracic aorta. They all run in the posterior mediastinum. So esophagus. Then if you take the thoracic aorta, it runs there. If you take the posterior mediastinum, you have got the cisterna chyli, which runs there. You got the ascygos and the hemiascygos veins running in this space. So that is why the posterior part of the mediastinum is very very important. That is why the posterior part of the mediastinum is very very important. And when you look into the contents of the superior mediastinum, when you look into the content of the superior mediastinum, trachea, esophagus, thymus, the brachiocephalic vein, arch of aorta and its branches, thoracic duct, esophagus, and left recurrent laryngeal node, not the right recurrent laryngeal node does not enters into the mediastinum. It is only the left recurrent laryngeal node which enters into the mediastinum and winds around the ligamentum arteriosum. So these are all the main contents of the superior mediastinum. These are all the main contents of the superior mediastinum. So questions can come easily from these areas. So please make a note of it. Okay, and several enlargements can cause mediastinal swelling in the superior mediastinum, and that could be because of thymus or thyroid enlargement, or it can be because of teratomas or tumors basically. So we can remember it as 3 T's or 4 T's for the swellings that are appearing in the superior mediastinum, for the swelling which are appearing in the superior mediastinum. Okay, now coming to the thoracic duct. So thoracic duct is the next VSV. So if they give anything in a green color, that is one clue. So lymphatic duct, they are usually given in the green color. So you can see a green color duct running in the thorax and the posterior mediastinum. Okay, so that represents the thoracic duct. This thoracic duct arises from a lymphatic sac called as a cisterna chyli. So lymphatic sac called as a cisterna chyli. It is present at the level of L1 and L2, and it is the starting point for the thoracic duct. Once the thoracic duct starts, it runs upwards through the aortic hiatus of the diaphragm. At the level of T12 vertebra, it pierces or it passes through the aortic hiatus. Okay, it runs on the right side of the thorax, and at the junction of T4, okay, it crosses to the left side. Okay, it crosses from the right side to the left side at the level of T4 T5 level. Okay, and it finally drains into the angle between the internal jugular vein and the subclavian vein. Okay, so it drains into the subclavian vein. Ultimately, it opens into the left subclavian vein. This is very very important. This is very very important. Okay, it opens into the junction of the left internal jugular and the left subclavian vein, which is very, very important. So this is a largest lymphatic sac in the body, and it drains almost all parts of the it drains the lymphatics from almost all parts of the body except the right side of the neck. Okay, and except the right side of the thorax, the right upper limb, and the right side of the heart. Okay, and the convex surface of the liver, they drain into the bronchomediastinal trunk on the right lymphatic trunk on the right side. So these are, they all drain into the right lymphatic trunk. They all drain into the right lymphatic trunk. Right lymphatic trunk. Rather than that, the entire body is drained by the thoracic duct. That is why it is an important um, lymphatic duct in the body. Okay, so this is about the thoracic duct. Next is the fontanellas. Next is the fontanella. See, they can ask you, they can put you a mark here, and they can ask you what is this fontanella is. They can put a mark here, and they can ask you what is this fontanella is. So if you see the fontanellas, there are anterior fontanella, posterior fontanella, anterolateral fontanellas, posterolateral fontanellas. This is the place where the sutures meet, and the skull hasn't ossified as a bone there. So these are all soft areas in the skull, and if you